Alcohol withdrawal syndromes occur following sudden withdrawal from alcohol, and they are often seen 12 to 18 hours after the last drink, but may be earlier in hours between 24 to 48 hours after onset. And this commonly occurs in patients admitted to hospital for other problems, for example, arising from accidents or physical illnesses, which keeps them from drinking. The presentation varies from minimal tremors to states of full-blown agitation and confusion, which are potentially fatal. The causes: abrupt cessation or significant reduction in alcohol intake in the individual with heavy drinking over many months or years. So the onset for minor withdrawal is 12 to 18 hours after last drink, but may be earlier. It peaks between 24 to 48 hours. For alcoholic hallucinosis, as the onset is 12 to 24 hours after cessation of drinking, and generally stops within 24 hours, within 48 hours rather. And for alcoholic seizures, the onset is usually 7 to 36 hours after the last drink, but maybe earlier. So for minor withdrawal, the symptoms are shaky hands, headaches, insomnia, mild anxiety, nausea, vomiting, sweating. For alcoholic hallucinosis, and the symptoms are sensation of objects crawling on body, seeing objects not really present, hearing noises or voices nobody else can hear. For alcoholic seizures, there are sudden generalized seizures in chronic alcoholic. And for minor withdrawal, the main signs are increased pulse rate and raised blood pressure. For alcoholic hallucinosis, the signs that are usually elicited are the vivid hallucinations, which occurs in clear consciousness. Also, pulse, blood pressure, and respiration are also within the normal limits. So for alcoholic seizures, the signs are generalized seizures. So the main treatment objectives are to stabilize pulse and blood pressure, to prevent dehydration, to treat presenting conditions like malaria, to relieve pain, tremors, and seizures, to stop hallucinations. And non-pharmacological treatment, we sit or lie down in a quiet place. So a patient will sit and lie down in a quiet place, and physical restraints may be required temporarily for very agitated patients. Also, encourage intake of fluids as can be tolerated to prevent dehydration. Pharmacological treatment: first line treatment, to give haloperidol oral or IM in adults 5 milligrams 8 hourly as required until hallucinations cease. In children, we refer to specialists. Or you can give olanzapine oral in adults 5 to 10 milligrams 24 hourly with a maximum of 10 milligrams 12 hourly. In children more than 12 years, we give 2.5 to 5 milligrams stat, and then may be increased up to 10 milligrams with a maximum of 5 milligrams 12 hourly. Referral criteria: so refer patients with alcohol withdrawal syndromes to a psychologist or psychiatrist. Also refer all children to a pediatrician.